patient presented to the office in the waiting room, and they have a known history of seizures. They are currently having a seizure while they were in the waiting room. So I will come to the scene, I will clear the scene of anything that could potentially harm the patient, and then I will make sure that I have proper PPE on, make sure I have gloves and a respirator, or not a respirator, a mask on with COVID, and gloves in case they hit something and start bleeding, or if they start convulsing and foaming at the mouth, make sure that I have that on. Then I will apply a pillow behind the patient's head. Lightly raise their head slowly, carefully, and I'll make sure that everything else is out of the way, and that all the patients make sure that other patients make sure that they're staying away. I'll set a timer. I would have done that right as soon as I came in. And okay, and go for 5 minutes. Since the patient has a known history of seizures, 5 minutes is when, if it goes past that, if it's longer than that, then I would call 911. If the patient is having trouble breathing, I would call 911. If they have multiple seizures that stop and start, I would call 911. And if it stops before that, I would instruct the patient to get a ride to the ER and go and see their primary care physician. I would make sure that I would follow up with their primary care physician and understand so that they know what I saw, and make sure I document it properly.